Acute stress disorder is defined as a stress reaction that occurs in the first 4 weeks after a person has been exposed to a traumatic event. If the time period exceeds after 4 weeks, it is generally taken as post traumatic stress disorder. Coming to the features, features involves intrusive thoughts, for example, flashback and nightmares, dissociation, for example, being in a daze or time slowing. Patient comes with a negative mood. There is generally an avoidance and an arousal, for example, hypervigilance, sleep disturbance. Management of acute stress disorder involves trauma focused cognitive behavioral therapy, which is called CBT as well. It is the first line. Benzodiazepine can sometimes be used for acute symptoms, for example, agitation and sleep disturbances. However, due to the addictive potential and concerns, they may be detrimental to adaptation. Acute stress disorder is generally compared with a post traumatic stress disorder. Post traumatic stress disorder is defined as a stress reaction that occurs after 4 weeks of a major traumatic event. The traumatic event could be a major disaster or a childhood sexual abuse. There is no age limitation, it can develop at any age. Coming to the features, features are divided into four main categories, which is also an important exam question. Number first is re experiencing. Number two is avoidance. Number three is hyperarousal. And number four is emotional numbing. Now, defining each entity one by one. In re experiencing, patient experiences flashbacks, nightmares, repetitive and distressive intrusive images. In avoidance, they generally avoid people and situations or circumstances which resemble or associated with the traumatic event. Hyperarousal means hypervigilance for the threat, exaggerated startled response, sleep problems, irritability, and difficulty in concentration. Emotional numbing is lack of ability to experience feeling or feeling detached. There are certain features as well which can be seen in patients with post traumatic stress disorder, which includes depression, drug or alcohol abuse, anger, or unexplained physical symptoms. Coming to the management of post traumatic stress disorder, management is divided into mild and severe cases. However, single session interventions are often not recommended. In mild cases, watchful waiting is generally used, and it is also true for acute stress disorder as the symptoms are less than 4 weeks. In severe cases, we usually give trauma focused cognitive behavioral therapy or eye movement desensitization and reprocessing, which is also called EMDR. Drug treatment for post traumatic stress disorder. It should not be used as a routine first line treatment for adults, but if at all we want to use any drug treatment, then venlafaxine or selective serotonin reuptake inhibitor such as sertraline should be tried. In severe cases, NICE recommends risperidone may be used.